A skin condition can impact the daily life of a patient because it can affect their general well-being in their ability to sleep, work, and their mental health as well.
What you see now is me having a good work day with my makeup on, but you don't see what's underneath. Well, when I've had a really bad flare-up, not being able to manage it, I've just stayed at home, cancelled appointment, made excuses. I just felt it was a condition people wouldn't understand. I have a variety of conditions that include psoriasis, eczema, rosacea, and blepharitis, which is an eye condition but directly related to the skin conditions.
There's over 3,000 different skin conditions. Dermatologists are trained to manage all of these conditions in diagnosing, management and treatment of them.
I had eczema, started around 10 years ago. For me, it was not being able to perform at my best. You know, everything from relationships, family, work, friends. After years, it just didn't feel like it was ever going to end.
My skin condition is alopecia. I originally was diagnosed when I was around 16 to 17. I actually specifically remember my worst day. It was the realisation that I was losing all my hair and I had to let go.
A good patient-doctor relationship can go a long way in both correcting the skin disease, also helping the patient recover psychologically from what can be a really distressing time in their lives.
My dermatologist has been a partner with me in my entire diagnosis. Before my appointments with my dermatologist, I always like to go back through my diary. So I prepare by jotting down notes that since my last appointment, anything to fill her in on. And then I guess going in with an open mind of listening to what the latest treatments are out there.
It's really important to listen to the patient. It's really important from the patient's perspective because they need to be able to communicate what's working and what's not with a treatment plan. But it's also really important from the doctor's perspective too, because we need to be able to accurately gauge when a patient is engaging in a treatment and what's working and what's not for them.
One of the main things for me has been having that expert in my dermatologist recognize my different conditions and recognize how to treat them at the same time but differently. Without that advice, I would be lost and I would be really suffering and I would be self-conscious. I would not be going out in public. I would not be getting on with my life.
Ultimately, I think getting the professional help turned my condition around.
To me, it's vital to develop an honest and open relationship with your dermatologist. The more that we know each other, the more she understands where I'm coming from if I don't want to try a particular treatment regime. Similarly, the more she knows me, she knows things that I may consider. Around my wedding, I wanted my hair and eyebrows regardless of the side effects. That's what I wanted. Whatever choice I made, she was my champion along the way to help me.
We are so privileged as dermatologists that we get to help people and manage them on their journey towards skin recovery.
You don't need to do this alone.
Getting help helps.
Getting help is only a conversation away.